Hello, my name is Dr. Robert Donatelli, and I'm a physical therapist specializing in orthopedic and sports. Today I'll be talking about plantar fasciitis. Plantar fasciitis is an interesting diagnosis because it really is a continuous overuse injury with continual overstretching of the plantar fascia. Plantar fasciitis commonly presents as pain in the heel or arch of the foot. Running, dancing, and other activities that repeatedly pound the foot on the hard surfaces or put too much tension on the plantar fascia can cause micro-tearing of the fascia, which can lead to irritation and inflammation. Other contributing factors including tight muscles in the posterior compartment of the leg, such as the gastric soleus, lack of proper conditioning before increasing activities, obesity, degenerative loss of elasticity in the fascia, and extremely high or low arches. Injury to the plantar fascia is most commonly seen on the inside and middle portion of the fascia where it connects to the calcaneus. This condition commonly presents as medial heel pain and that is usually felt after exercise or when taking the first few steps out of bed in the morning. Let us focus on the medial central portion of the calcaneus. We may see an increase in pronation of the rear foot during walking, which is called closed kinetic chain pronation. It occurs when the calcaneus moves into eversion and the talus moves into adduction and plantarflexion. This collapses the medial arch, and as the calcaneus moves into eversion or lateral, the movement may overstretch the plantar fascia, which is attached medially to the calcaneus. With continual overstretching, there are micro tears of the plantar fascia at the attachment site on the calcaneus. This may cause bleeding in the area as well as a release of calcium. The calcium deposits in the blood often lead to creation of a heel spur, which can be seen on the undersurface of the calcaneus. This spur is initially a cartilaginous structure, so it is not visible on x-rays, which could be for some time, possibly a year. This chronic inflammation of the attachment site of the plantar fascia on the calcaneus is what's causing the pain secondary to poor mechanics of the foot. That brings us to the end of our discussion. Thank you so much for joining us today.